47 million people are medically uninsured in America today, and the number is growing. In 2006, it was estimated that 3 working-age North Carolinians died each day simply because they lacked health insurance. The number of medically uninsured in Wake County alone is 155,000 people. Uninsured adults are 6 times more likely to delay medical care than people with insurance. In addition to this bleak picture of health care, further barriers to medical access exist for members of immigrant communities as well as Muslim women because of culturally insensitive health care services. In order to address these disparities, in 2005, a group of physicians, medical students, and volunteers began to lay the foundations for a free medical clinic that would serve the uninsured and economically disadvantaged in Wake and Durham counties. The Mariam Clinic opened its doors to serve the community in October 2007.
What's important to bring up is that Mariam Clinic was founded by a group of people in the community, physicians, healthcare providers, and non-physicians, people from Raleigh, Durham, Chapel Hill. We all came together to help answer the question of what can we do to help those who are most marginalized, who need health care but do not know how to access it.
The Mariam Clinic is an interfaith health organization. We have treated over 1,000 patients without regard to race, religion, or nationality, and we pride ourselves in being able to understand multiple cultures. We are able to connect with our patients in a way that makes them feel at ease.
There are the people in our communities, especially the women. We are breaking the taboos who do not have access to preventive health care. Simple as like mammography preventing cancer, diagnosing cancer at early stage, or having Pap smear diagnosing carcinoma of cervix at earlier stage. These women have not gone to anybody else, but by providing them these opportunities, they have come forward. I think that is an enormous strength in this clinic. Not only that, but we are also breaking the language barrier. We have in our society people speaking various different languages. Some speak Spanish, some speak Arabic, some speak Urdu, some speak Hindi. By providing interpreters in more than 10 different languages, that helps us to understand their problem, and thus it helps to treat them really well and serve them really well.
मेरी तबीयत ख़राब है, इस वजह से मैं मरियम क्लिनिक आई, और इससे पहले भी मैं काफ़ी महीने पहले जब मैं पाकिस्तान से यहाँ आई थी तो मैं अपनी बेटी के इलाज के लिए यहाँ आई थी। तो मरियम क्लिनिक में हर एक का रवैया बहुत अच्छा है, और दूसरे यहाँ पर मैं अपनी लैंग्वेज में उर्दू में भी डॉक्टर से बात कर सकती हूँ।
मुझे 3 साल पहले डायबिटीज़ का बीमारी हुआ था, जो नेपाली मेरे मित्र है जिसका इनकम लो है, उसको मैं बताता 2-3 फैमिली आ भी रहा है मेरे कहने पर।
Just a few years ago, when this idea of serving the poor and the needy in the field of health came about, then we started looking for a place. Unfortunately, we even went to some small rooms and shutters, whatever shape or form the place would be. We wanted to establish this Mariam Clinic, but knowing the regulations of healthcare, we just could not start anywhere until a doctor came in and volunteered his place to be used on Sundays, and it is a milestone for someone who is on the streets to get a place to work with, and that attracted more and more people. Now we have a vision working with the board members who have a similar vision, that we actually establish a permanent place, a place where people can turn to in the case of need, a place where other volunteers would love to join us and take it to a whole different level, wherein we serve the people at large from whatever background they come in. We are always there to welcome them with compassion and with smiles.
The effort and put by these young children, boys or girls, to support the clinic on volunteer basis, weekend and weekend out, is amazing. it really heartens you and makes you feel as if any time you are giving to the clinic is worthwhile. And the smile on the volunteer's face makes you feel so good that you want to continue working in a field that seems to be a bottomless, requiring all your energies, all your times that you could be spending somewhere else. And this is the best thing that I got out of it.
I believe I've been one of the more fortunate people in the country. You know, I've had good health, and economically speaking, I'm in good standing. So, but you know, just going through some of the records that I see, you know, you just realize how much stuff you take for granted, and it really motivates you to work that much harder for people who don't have those same advantages in life.
I sought after the Mariam Clinic when I returned to school for a degree in nursing. I'm currently a certified medical assistant with 3 years of experience, and I really miss being in a clinic. I've always wanted to serve underprivileged, low-income, uninsured patients. My experiences have been absolutely fantastic and amazing, for a lack of a better term, with the Mariam Clinic.
What really drew me here and kept me coming back was the waiting room, was coming in and seeing the people expectant to be helped medically with situations that they had no other access for help from. Here we were actually serving people. We weren't talking about it. The folks that were involved with the Mariam Clinic were actually involved with doing it. And they were so heartful and so connected and so generous in their time that when I came in, I didn't expect what I found. And what I found was something very, very special.
The most rewarding experiences come from the personal interactions with individuals. As a physician, when I see patients in the clinic who tell me, I ran out of my medications for diabetes or for high blood pressure 6 months ago. I did not know where to go. The doctor had written me for an expensive prescription. It cost $60 a month. I couldn't afford it. I had to pay the rent. I had to feed my children. And these patients that come in with completely uncontrolled high blood pressure or diabetes, we're able to provide them affordable medications, start them on a regimen, a very simple regimen, and within 2 months, they are back on track. They can be as healthy as anyone without these conditions.
The Mariam Clinic would be able to treat more patients in need with increased resources and service availability. Anyone can help by donating or volunteering their time. Doctors are especially needed. Through everyone's help, the Mariam Clinic will be able to provide support to many more in need. Please visit our website at www.mariamclinic.org to learn more about us. The Mariam Clinic is a registered 501c3 nonprofit organization, and all contributions are tax deductible. Please consider donating online or mailing your check to Mariam Clinic, P.O. Box 4187, Cary, North Carolina 27519.